This is Community Connections, airing on OROMIA11. I am your host, Anna Orr, and today we are talking all things Black Maternal Health Week. We are going to share some really good information, provide you with some resources, and hopefully illuminate a very, very poignant issue to our community. This you won't want to miss. Thank you for joining me today, Danielle. I am so excited to continue a very much needed conversation around Maternal Health Week.
Thank you for the opportunity. Thank you.
Can you talk to me a little bit about your work as a birth doula and some of your experience within the community at large?
So my role as a doula is to help be a birth worker and a support to the birthing person in that space. I like to utilize my skills to be an advocate, but also just another support person. So I think everyone that usually is in the room has a role, and I kind of help make sure that everyone plays that role, all while also attending to the birthing person.
We've talked a little bit about Black Maternal Health Week. Let's talk a little bit around importance. April 11th through the 17th of this month has been labeled as Black Maternal Health Week. And we talked prior in a couple of episodes not long ago, a special shout out to Joy McAfee and the amazing work that she does with sacred birth work. We talked about the maternal death rate, specifically in mothers that are Black. Can you talk about the significance around the Black Maternal Health Week?
Yeah, so part of this birth or Black Maternal Health Week came from what do we want to call it? I like to say that it is an epidemic, but we see it as the mortality rates being significantly higher than our white women who are giving birth. So Black and brown mothers are 2 to 3 times more likely to die during birth. The CDC even says that 84% of the maternal death rate could be avoided with medical interventions. So to me, that sounds like there's not just a racial issue that's happening there's a systemic issue, right? There's medical bias that are playing a role when mothers are going to appointments and showing up in birth spaces that are going ignored and unanswered. And so the Black Maternal Health Week came to be about by just simply raising an awareness to the communities at large, but also on a national and a global platform, because it isn't just something that's specific to this community, it's happening everywhere. So like I said, I believe it is a systemic issue that happens, but it also gives opportunity for others to become aware, whether it's a friend, a sister, whoever it is, they're able to get the awareness and their needs met.
Now let's talk a little bit about statistics. You were sharing some information from the CDC, and for those that are unaware, the CDC is the Center of Disease Control. Maternal mortality rates worldwide are as follows: 3 to 4 times as likely in the United States, 5 times higher than our Caucasian counterparts in the United Kingdom, 5 times higher in Brazil. These numbers are really alarming when you start to think about what that looks like. When you hear how often people are getting pregnant, and then, not every 9 months, someone is running the risk of losing their life. And statistically, it says that any pregnancy-associated death, a death that occurs to a mom during childbirth or within the year following, is considered in this number. That's a really alarming number when you start to think about how many mothers are not being able to go home and raise their babies, or how many birthers are not going home to raise their babies. Can you talk to me about the call to attention around Black Maternal Health Week?
You brought up a really good point about the first year. So a lot of folks think once you're out of the hospital, you're out of the woods, and that's not necessarily the case. A lot of the time, like they said, the first year, so postpartum, most people only get 6 weeks off of work, and then it's kind of back to normal or back to business as usual. That's not the case. And so a lot of the time, there's not a lot of extra help or a lot of checking in. Yes, you have baby's wellness checks and things like that. And sometimes it's a questionnaire of how is mom doing? How is baby doing? Things look good, let's go on our way. But there are still things that are happening in mom's body. There are still things that are needing to be regulated as far as hormonal. There may be things that come as far as pre-eclampsia, postpartum. I know that's weird when you say pre and post, but these are things that are happening to mothers and birthers that aren't being considered and almost considered entirely too late. And so I think Black maternal health really brings, like we said, the awareness, but it also helps the family members, it helps partners and spouses to be cognizant of checking in regularly with those birthers, making sure they're paying attention to signs that maybe the birther doesn't recognize. It also helps with advocacy, right? We can talk to our local Congress people. We can talk to even, I would like to start on a lower level, talking to your provider. It starts more than just having a provider that's Black or that's the same cultural congruence as you, but making sure that you're asking the right questions, having the right advocacy, making sure that you're feeling like you have choice in your space, because you do. A lot of the times, families don't know. You can say, excuse me, that you're not comfortable with your provider, you're not comfortable with a nurse. All of that is all your choice. And you can go and change your provider up until you give birth. It's all about what you see yourself having in your birth journey and how that happens beyond the labor and delivery room. You have choice in all of that. And so I think Black maternal health does a really good job of raising the awareness, but also speaking to some of the things that family members and spouses can speak to on behalf of the birther and baby.
Okay. Now, I don't know if you're a mother yourself, but can you talk a bit about your personal connection to this work?
So I was introduced to birth work in a really strange kind of roundabout way. I like to call myself a girl's girl. I am all for women empowerment. I am all for supporting women. I have great women in my village, in my community, and my friend circle. And so I wanted to figure out how I could bring more support to women of color here in Minneapolis. A lot of people always say, I didn't know there was Black people in Minnesota. Like, yes, hello, I'm here. I have family, we're here. And so I wanted to figure out a way in which I could really uplift and support women. That was one of the ways that I was introduced to doula work and birth work. And from then on, I just really fell in love. After hearing the scary facts, they're scary, but they're real. And so hearing those, I immediately felt a deeper need to really help Black and brown women. And so that's kind of where I started my work. It's carried me on through my own motherhood journey. I was able to get a doula after figuring out what a doula was and becoming one myself. She was great. She helped me and my husband during our process, and I felt like it solidified even more what my passion and drive was to do this work, and I feel like I bring it with me every time I talk about it or attend a birth.
Can you talk to me about the ways in which your doula during your pregnancy came alongside you and your husband in ways that you guys found beneficial as someone, not just as someone who does this work, but as a mom yourself?
There are a lot of things that you don't think about while you're giving birth. You're only trying to have another human. And so my doula was able to talk to nurses on my behalf when I wasn't really able to. She was able to communicate what they were giving her as information and bring it back to my husband and I in a way that wasn't so medical jargon filled. It wasn't words or things that I hadn't really heard of. She also was able to make sure that my birth plan was able to be carried out in the way that I wanted. I like to call them birth preferences because, as we know, plans change. And so she did an excellent job of making sure that all the things that I wanted were being carried out. I mean, even there was an instance I remember where the nurse came in and she gave me a nickname. And I was like, we're not familiar in that space to give me a nickname. And my doula immediately was like, yeah, she's going to be called Danielle, and this is her husband, and this is what he'll go by, and so we're going to try to stick to that. And so really just sticking up for me, advocating for me, and also paying attention to the little things that I didn't really give thought to while I was birthing. Another major thing I would say is that she really helped my husband. She supported him and made sure that he was good. In those moments, I like to tell mothers that this is the only time that you can take all the attention in the room. So take it. And so I was able to kind of go within myself and kind of, talk to myself and talk myself through the process. But she was also able to help him be there and be a support to me, but also make sure that he was taken care of emotionally as well.
What are some of the ways that you would say that we can improve Black maternal health overall?
I would say keep asking questions. I would say keep seeking out providers and clinics that you hear are doing good work. I think one thing we see in this work is that families, we refer family members to specific providers, not necessarily clinics. And so I think if you have a great provider that you love, tell your family, tell your friends, this is where I'm going, this is who I'm seeing. She or he is doing great work, and I think they offer safe spaces, they offer safe practice when it came to me and my baby's care. And I think being able to just keep spreading the word. A lot of the time we hear a lot of stuff coming from, like we said, the CDC. The White House has even put out some releases about Black Maternal Health Week. We just hear a lot of different things through social media, and a lot of that can be scary. But the beautiful thing about proximity is relational conversation, I feel like, feels better. It offers more opportunity to ask questions. It just feels safer. And so if we're able to be educated and to raise awareness and to tell people about those providers who are offering great services and things, we have to keep doing that.
How do you encourage people to advocate for themselves in medical spaces, especially when we hear such daunting statistics? And like you said, you're in a state of, I would say, you are probably trying to navigate so many things at once.
Yeah.
So how do you,
High
speak up and
energy.
keep telling those that matter what you need while you need it?
Yeah. I would say, like I said before a little bit, just remember this is your birth experience. This isn't something that's happening to you. You are taking part in something that you are doing something. And so you get to have control and you get to have say. And I think a lot of folks don't understand that when it comes to medical advice and things. Yes, you want to take the advice of the professional because they've gone to school for this, but you also are the boss. You know your body. You know if something doesn't feel right. So to continue to ask questions, to say things, pushback is good. I believe that being able to ask, well, why are we doing that first? Talk to me about that before you touch or, say and do things. Asking those questions, pushing back, saying things, those are all good because I think they lead to educational ends, right? You never know unless you ask. And so I think having folks be advocates, also inviting doulas into your health journey or your birth journey is really good as well, because they may be able to speak to things that you can't, but they know what your intentions and your wishes are before you even get to the labor and delivery room. And so they can help you navigate that. So yeah, just a lot of choice and a lot of using your voice is really what I think saves us.
What are some of the ways in which you navigate having conversations about the grim statistics that are surrounding Black birth?
I think it's important that we lay it all out on the table, right? We need to know what we're going into. There's a book out there that's like what to expect when expecting. A lot of that stuff in the book is real. Like you are to expect contractions. You expect to see and smell and hear and all the sight and sounds things that you would normally expect in a birth space. But I think we can't stay there. We can't stay afraid, because I think that's what paralyzes us, and it doesn't allow us to move forward. And so I share with mothers and families these statistics on account of why it's important to advocate, why it's important to have a doula, why it's important to seek out your best provider, because we can't stay scared. We have to rise. We have to take hold of our births and make sure that we are aware, but also just letting the medical staff know that we're aware too.
Now, we've talked about some solutions, which I always like to lead with, because a lot of us are able to navigate or have heard at least an initial conversation surrounding what our problems are, or points of opportunity, as I like to call them. But let's start to talk a bit about what are some of the issues that are surrounding the mortality rate, not only with mothers, but also their babies. I know some of it is systemic racism, some of it is access to care. But can you kind of elaborate a little bit about what that looks like?
Yeah, so those two are major, right? Systems, we come in and we're viewed as one way just because of medical bias. Our skin speaks before we even get a chance to. And so that's one thing. I think, like you said, access, right? Having access to quality care. A lot of families don't know that you can have doula care covered in your medical insurance. Now, Medicaid only covers up to $600, and that's low for birth workers, but it is, it's covered. It's a part of your plan, and it's your right to have that. And so being able to, so another barrier I would say is the belief of pain and tolerance in Black and brown women, right? There's been medical journals that are still, and books that are still actively being used by medical schools saying that there are Black women and brown women have higher pain tolerance. Not true, but these are things that are being planted in the minds of these medical workers, and so they're ignoring the calls and the feelings of not feeling well and things like that. And so those are just some of the barriers I would say that are being placed on Black and brown birthers in these spaces that are adding to the mortality rates.
According to a study at the University of Florida, it states that Black children have a higher survival rate if delivered by a Black doctor or birth worker. I think this is such a stark statistic to share with people, to realize that if someone that doesn't look like you and I is delivering your baby, you or your child may not survive. Right. Can you talk about some of the things that we can do or resources most needed by healthcare providers to better support Black birthing work?
I would love in a perfect world to see medical staff in the community more, not just in a way that's I'm wearing my doctor or my nurse's hat, but literally being amongst the families, seeing the families, understanding cultures, and being able to see people for people, not just a statistic, not a race, not a body form, but literally seeing people for who they are. And I think a lot of that would alleviate and eradicate some of these mortality rates that we're seeing, but also alleviate some of the stresses that birthers are feeling when they're seeing non-cultural congruent medical professionals in the rooms with them. I think those medical professionals will then also be put at ease, but I don't believe it's the patient's responsibility to make their professional feel comfortable. I think it should be the other way around, and I think the only way that that can happen is if they see each other and they're in the community and they're feeling welcomed, but also feeling knowledgeable of these people.
Share with me a bit about ways that we can start to support people that are expecting in our very own lives.
I would say just by checking in on the birther. A lot of the time, people are so excited to come and see baby, but there also may be unspoken things that may be happening with the birther that we don't know about. And so being able to just offer support to them directly, checking in with them on their mental health, taking a break and cleaning up around the house, not asking to be hosted when you come to visit. Find yourself doing something to really support them, and maybe offering them other supports. I think there needs to be a call for postpartum support in mental health as far as therapy is concerned. I know for me, I took it upon myself to make sure I developed a relationship with a therapist and decided to consistently start going to therapy to help aid in that process, because I knew there were some things that I probably didn't feel comfortable talking to with my spouse or, those in my tight circle that I feel safe enough to share with my therapist. And so just offering a lot of support holistically when it comes to the birther, and not just coming to see baby and making sure baby is cute and bringing toys and all this different stuff. It goes deeper than just, like we said, that first year, but also just happy to receive a newborn baby.
Now, you've talked to us about you've talked to us about the work that you do in the community, but for those that are interested in some of your services or in connecting with a birth doula period, where is a good place for them to kind of start?
Yes, so there's actually a birth doula registry through the state of Minnesota that folks can sign on to online. I do not have the exact address, but you can Google it and it literally will pop up. There are Facebook groups that folks are taking part of. There are BIPOC specific Facebook doula groups that doulas are on there who are open to take clients. They are looking to serve families. They are looking to plug families into different birthing spaces. And so it's just a really good community. I think that is untapped here in Minneapolis. Yeah, there's a lot of different organizations as well throughout the metro that are helping kind of lower the rate by offering doula services. Some do cost, others don't. It's just about respective organizations. There's an awesome program that is helping dads become doulas. And so all of this is online. You can access them at douladads.com, and they can, that information will be shared on their website. But yeah, there's a lot of different spaces. It's all through word of mouth that really helps us. We can never do enough work on social media getting the word out, but also, just like I said, referring family to family, referring practitioner to practitioner. Just word of mouth really helps get the work out.
I appreciate that information. Now, my favorite part of the evening is where you get to look into this camera and provide our viewers with a call to action for us to not only come alongside you and other birth workers, but to help us support the community at large so that we can start to see a decline in the mortality rate around birthers and their infants.
Yeah. I would just say, if you know a doula or a birth worker, postpartum, doulas, anybody that you know that may be a part of birth work, check in with them and ask how you can help, whether it's providing meals to them and their family while the doula goes off and attends to another family, whether it's providing gift cards to help offset parking costs at hospitals. There is a myriad of ways that folks can receive services and help while they do this work. It definitely is appreciated. Like I said, it's not a well-funded. You don't join in this work to be paid. You do it from your heart, and it's a lot of hard work. And so anytime community can come alongside and support you or support a doula is greatly appreciated. Love on your Black and brown doulas and mothers and families who are expecting, and make sure that you are advocating, whether it's through the local level, national, however, you have a platform, use it. And if you care about Black and brown birthers, let somebody know.
Thank you, Danielle Buckner, for your amazing work and your service to the community.
Thank you for having me, and thank you for this platform.
Absolutely. That is all the time that we have for today's episode of Community Connections. I hope that something that has been said or done here has been informative and or educational to you. Please make sure that you are checking on those that you love that are expecting children, and please Google some of the resources that were shared by Danielle today. As always, I am Anna Orr, and I look forward to connecting again with you soon.